tell us about that case count. Down to 4 patients now. Are you seeing new patients come in?
No, so Tyler, and thanks for having me back again. It's a real honor to be with you. We've been down. We actually hit 0 last week, and just this week went up to 4. 3 of those 4 patients were actually transfers in from other regions because they knew we had access to certain trials. So it's not a local surge at all, or not even a surge, uptick in cases. So we're still very, very optimistic that the community in northern New Jersey and in New York and Manhattan, the virus has been very quiet.
You all were hit very hard early, and I know you have not let your guard down at all. You're still on your toes because you're concerned about a possible resurgence in the fall that could coincide with the flu season. Do you have enough protective gear? Are you able to source it? Where are you stockpiling it?
Yes. So yes to all the above. We are continuing to grow our supplies here so that we have enough inventory to handle another surge. If you recall, we had built a number of specialty ICUs very, very quickly in the middle of the pandemic and the crisis here. Those ICUs stay up and ready to go, even though they're empty right now. And so if we were to have another surge, the issue with ventilators, the issues with PPE are all fine. Testing still seems to be the biggest constrained resource, so getting reagents to run the different instruments. We here at Holy Name have 4 separate instruments that we source to run SARS-CoV-2 testing, but getting the reagent supply for those instruments is still a challenge.
Michael, in your view, what do you think a second wave looks like? Is it as bad as the first wave, or are there things that you've learned in dealing with the first wave, and were there enough people who might have developed antibodies since the start of the pandemic to maybe make the second wave a little bit more blunt in impact?
Well, good question, Melissa. And again, good afternoon to you, too. We are concerned about it. So we know people who were infected in the first wave, myself, my family, the antibodies are not lasting very long. So that's a little concerning. It's a little concerning about the long-term efficacy of a vaccine. I know everybody's working very, very hard to try to isolate that and incredible positive movement. But there's still a lot of uncertainty and a lot of unknown. It's very difficult to develop an effective vaccine if the antibodies are fading as quickly as we see. So that gives us concern for a second wave. The second learning factor that we now see in Florida and Texas and California, Arizona, is this virus does not have seasonality to it, which means it's not really impacted by warm weather. It's not impacted by longer days of light and UV light helping deter it. So we're very concerned that come the fall, this wave could come back to the East Coast. There's no indication that it wouldn't. There's no indication either that it will. So we have to sort of plan for the worst and hope for the best in this.
So, Michael, I know you're not a medical doctor, so what I'm going to ask is, with all due respect to who you are and what you do, but you hit on something that I've been thinking about a lot, and that is the seeming transience of antibodies, which, as you said, means that you may not have those antibodies long if you have them. It certainly calls into question how effective a vaccine may be. So the question then is, what is your sense? What are the medical professionals telling you about whether we're just going to have to live with this virus, maybe at a blunted incidence because of a vaccine and because of antibodies, the way we live with the flu? Or are we going to have to get used to the idea that we may be social distancing and wearing masks all the time, maybe for decades?
Yeah, well, so I think, Tyler, it's a great question. And it highlights the fact that even at this stage of the game, there's more about this virus that we don't know than we really do know. And I think everybody needs to start to plan. In fact, I had several meetings here today in terms of our intake process and how we're screening people. I said, guys, this is not going away anytime soon. And when I say not anytime soon, it's a new norm. We're going to be doing this for the next decade. So we got to be prepared as to how we respond. There are actually some efficiencies and some opportunities in that. So the cloud has a little bit of a silver lining, but we can't just go back to the way things were. So screening people, masks, unfortunately, some semblance of social distancing. But I'm also a big believer in what I call cluster surveillance. You have to look at a region. You have to look at a virus like this. And right now, it's not active at all in New Jersey and the New York area. We can ease off a little bit. We got to be cautious. We got to be guarded. We got to have our surveillance systems fine-tuned, which they're not. That's a work in progress. But with that, I think that becomes the new norm, and we can return to some semblance of a normal life. But we have to have that very, very vigilant surveillance system in place.